Hi there, Dr. Brian here. In our sequence of answering your questions, a question we have seen is, could back pain make you sick? And the answer to that is it could. It would be extreme pain, the pain that would be nauseating, and that could definitely cause you to feel sick with an excessive amount of pain. Extreme pain may be a sign of a bad occurrence, say a ruptured disc, and if it is unrelenting pressure on a nerve, that will create an unbelievable amount of pain that's very, very hard to relieve other than relieving pressure on the nerve. So commonly even opiate drugs, opium-based drugs will sort of knock the head off it, but they won't make it go away. So the deeper question might be, if it's not a severe disc or back injury, then what else could it be that might make you feel sick with back pain? Now, we've seen in clinic and also in various understandings of how the body works with relationship between the feedback loop between the organs and the spinal cord, that if there's, say, a very high level of indigestion, either stomach or small intestine, that will create a much higher rate of information from that organ back through the spinal cord to the brain. And what we often see is that the nerve impulses are so continuous that there's actually a spillover into the muscles around the joint where that nerve from the organ hits the spinal cord. And that is commonly called viscerosomatic. So the viscera, the organs, are affecting the muscles or the somatic body. So with that in mind, it could be that there's a high level of digestive upset that actually creates a moderate level of back pain. It can be quite sharp, but it's nothing like that extreme nauseating nerve pain, which would usually radiate. So the difference between the nerve pain that's giving you a sense of nausea is usually that pain usually radiates. It might go all the way down your leg to your foot. It might travel up your back and into your neck and head. Whereas a visceral, an organ-driven pain that ends up in your back or creates back pain will usually be quite specific. So if you were to touch the spine, it would be very tender, but without that touch it would just feel sort of achy, burny, kind of like lactic acid buildup. So that would be the two reasons why you might have back pain that is related to feeling sick. One is the feeling sick is a product of the back pain, and the other is that the feeling sick creates a much lower level of back pain. In either case, you potentially would come and see the chiropractor first, because if it's structural, in either case we can relieve it. There's no doubt clinically that adjusting a level that's got a organ level of irritation, that actually will help the system quiet, because you reduce that loop between the organ and the back, you cut it off, and that will often let the organ settle. And also we will often do a visceral manipulation, which is a very classical procedure to adjust the organs in the gut, and that will often relieve pain. There's often a torsion in the organ because of the muscle activity, and if you're able to settle that through various techniques, then that will often relieve the pain significantly, and subject to it not returning, that's cleared. And obviously there are cases where you may go directly to the emergency area of the hospital, or go and consult your GP, doctor, physician, and have them give you their judgment. Usually not a medical emergency, but certainly radiating pain down the legs that causes you to feel sick, that causes a change in your bowel and bladder control, is usually a significant red flag. and would indicate that you may end up with a ride in an ambulance to hospital and have some sort of surgical or other intervention. However, we won't go to the deep end, we'll start at the shallow end and work our way down there. So that's the answer to the question. Back pain could make you sick, and a sickness in the gut could actually give you back pain. So hope that helps. Any further questions, just do feel free to add comments below. So the comment boxes below will allow you to pose a question which we can come back and give you an answer to. Okay, all the best.